Hello everyone. So welcome to the Global Physio PC strategy class and success story. This one is to congratulate the student as well as giving the strategy to others who are in their path for the resident PT. Okay, let's admit everyone and then we'll start. Hello everyone. I'm gonna wait for others and then we'll start it, okay? So basically, this is the session to give you the idea about how to prepare yourself for the PC. PC is a long journey where students are getting ups and downs. They're sometimes they're confused what to do, how to do. Sometimes they are thinking, even though they know they are lacking somewhere. So what to progress, how to progress, and basically it is best way to get your idea with the passing student as well as if you know before. So before going your exam, if you know the strategy, that is very, very helpful. I'm just gonna wait for the few students and then we'll start it. Hi, Joey, congratulations.
Hi, thank you, ma'am.
So how you feel now?
Ah, feeling good, obviously.
Finally,
Yeah, finally it's over.
finally is over. So basically, we have so many students who clear the exam with the flying colors. And after feeling, so when you are passing through that process, that is a painful. Psychologically, socially, the sometimes some students economically, everything,
एग्जाम
financially, everything
मेरे
is.
अभी क्रेडेंशियल्स अप्रूव्ड नहीं हुई अभी
So that's up and
ये
down.
नॉन
Joey,
प्रेसिडेंट
your,
स्ट्राइक थी
just a
अजय
minute.
तक वो थी है
Sorry, who is this? Ashwin. Yeah. Joey, can you share your few words for your journey?
Yeah, it was exhausting, no doubt. But after all, it's hard work. Definitely, it's hard work. And the exam, I felt it's more about ethics than knowledge.
That,
They're actually checking your critical thinking.
yes,
Yeah.
that's true. In
And
what
I
way
feel
ethics?
relaxed mind is much necessary for exam. Like
Mhm.
have good sleep before you sit down for your exam. And keep your anxiety down. That's a lot. Yeah.
Very, very important. Very, very important is you are very relaxed. Because if you are not relaxed, you are not capable to focus the keywords. So very, very important thing is the relaxation. And you are only relaxed when you are prepared 100%. Your concept, your knowledge about the ethical background, everything is important. Now, first of all, for the new student, what is ethics? PCE ethics is totally different. It is very, very important to understand your ethical principles, ethical application of the treatment, interventions, mainly interventions, assessment, uh, patient-centered approach. Patient-centered approach means patient is the center for the benefit. Patient is coming with you for the purpose of the well-being. Therapist goal towards the make the patient functionally independent. So ethics is not only just it is given on the website. It is not only that point. Ethics, that point is extremely important. Along with that, your understanding about your concept with ethical point of view. For example, I'm giving you the example of multiple sclerosis. Multiple sclerosis, already at the late age, the process started, patient is deteriorating progressively. So in that one, how to read your concept. So first of all, definitely you're gonna read your concept with the thorough way, like all the pathophysiology, your application of your assessment. But in the assessment, starting with your patient history, I can say. First thing is consent. So consent is the baseline, informed consent is the baseline. Now this is beginning of the assessment and every day of the treatment. Your consent is equally important. Second thing is, patient has every day some questions. How to give the answers for that question is also important. Patient has on and off deterioration. Patient has a question regarding some question which is out of the scope of your practice. So how to answer that scope? That is also important. Welcome, Ankita. Hi, Ankita. Welcome. I think you are mute. So that, Ankita, I think you are mute. Okay. So the thing is, when you are doing the assessment, when patient has a question, when patient has some aspect, they are asking you because they are very comfortable with you. You are the person that daily touch with the patient. So whenever patient is asking something, you must answer the questions ethically. Welcome, Ankita. Congratulations.
Hi, Mamta. Thank you so much. Thank you.
Finally.
Finally.
So here there are a few students, and I'm gonna tell them that what are the strategy. Like, would you please elaborate your journey?
Okay, right away. Okay. Yeah, I mean, it was tough for sure. It was all a lot demeaning for sure. It was challenging, yes, again. But then the main thing is that I always knew that this is my aim, this is my goal, which I have to appear. And you know how we say that to attain any hard work, we definitely have to go through a lot of like crests and troughs, and this was my journey for sure. It was a long one, but thanks to you, first of all. Again, for other people, I'm not like buttering up or anything, but literally, Mamta did made my journey way smoother. And I mean, I got a better pathway, to be honest. I knew, like, I was, because first of all, last March, I did not clear my exam. I did study hard. I did read books before that also. I did everything. So when I did not clear my exam, I just thought, okay, what's lacking? Definitely there was something, but I was not able to figure out. And then through some of my friends group, I did come across Mamta. And when I had the first call, I remember still, I had many doubts again, like because you are trying to invest your trust in somebody when you don't know what the issue is, basically, right? But she made me so comfortable only in the first call. That was my
Thank you
experience,
for
that
that.
first experience, basically, because I definitely needed that a motivation, not only academically but even like emotionally. And I cannot just say that you are my mentor. I think you were even like my teacher, my friend, my motivator, everything. Like, yeah, I did invest my energy, but I remember that you were always there. So that was something, and always motivating, especially because, guys, I'll tell you, like, I'm a person with anxiety, with like, of course, like that negativity which just draws upon you when you are preparing. And I think everybody goes through that phase, right?
This
But
is a
then it
normal psychology. Actually, if you are a psychological person, you know it is a normal human psychology going through this ups and downs. Sorry, Samiksa, just a minute. Yes, go ahead, Ankita.
Yeah, so I mean, exactly like Mamta mentioned, that it is very normal physiological process that you will feel emotional, you will feel demotivated. But again, at the end of the day, my own determination, definitely. But then, according to this course, all the strategies, all the tips and tricks which I knew before, but again, then that it was all started from a different baseline, and which was all given to me by Mamta. So that really helped me a lot. Her resources, guys, if you are already with Mamta, or if you're going to join, or I don't know, but please listen to her carefully, whatever she's guiding you through, actually, because her PPTs or her whole study material, her questionnaires are from nowhere, but it's just our core books, which is also the blueprint says, right, that you have to follow all those books only. So rather than, like, trying to diversify your approach to this material, that material, I would say whatever she's giving and your books, they are only your, I mean, literally friends, and
Yes.
that is what is basically being asked in the questions too. People wonder, I wondered, like, where all the questions or the ethics and everything is coming from. But it's all, it's everything is given in the book. It's just a matter of your
Yes.
investment of energy and your strategy, which you will eventually learn in your pathway as you move forward day by day, that how to navigate through that. So yeah, so I mean, thanks again to Mamta.
You're welcome.
So much.
I know you. So, see, whenever, what is the main thing for the exam? How to prepare? Beginning, books. When we are a small kid, we know that we write a essay. Books are our best friend. Same principle apply here. Everything is given in the books. It is nothing hard. Only your approach, how to study. You are not gonna focus with only small things. We all, as a human, we all, when we are student, we think that okay, whatever small thing I can go ahead, whatever I can skip, it is good for me. No, there is no shortcut, and it is only your first and last try. That's what you have to think. There is no other option. So this is very important. Now, important points are how to study. So study material, study thing, everything you know, but somewhere you are lacking. What that portion? The portion is first your concept. Very basic concept. Even though you don't know plyometric, it's okay. But if you don't know the joint anatomy and mobilization, that's not okay. So the basics must be there, and it is must, every student must go through that. Second thing is correlation. PC is correlation. It is not standalone questions. Correlation is extremely important in your given topic. So given topic, I am saying, for example, elbow joint, very easy joint. And I am saying tennis elbow. Just getting one scenario. Tennis elbow, repetitive injury, it is a muscular thing, overused thing. But you may get questions about the orthosis. You may get questions about the patient is unable to do the factory work, and that patient is getting depressed because he is the only bread and butter for the family. So how to motivate him to enroll in the your therapy? Again, basic questions in terms of acute management, subacute management, return to the functional status, that is also there, along with patient's functional independency. So this is ICF model, International Classification of Functioning. So that ICF model, we all as a physiotherapist are working on to make the patient as much as independent. Now that question also comes with the spinal cord injury. So spinal cord injury, as per the level, there is a functional expectation. Not every patient go at the end, but as a therapist, we must know what is the functional expectation of that particular level. And if definitely patient has n number of questions. So answer the question appropriately within your scope of practice ethically. So every time ethics is the base, very beginning. So ethics, like Juhi, do you say something about ethics? Priyanshi is here, I
Ethics,
think.
yeah, it was all about ethics. I felt the exam because
Hmm.
every winged there was a question about ethics at the end of the every winged. And
Yeah,
even last standalone questions, it was also about ethics. And I also took Mamta's classes, and I know I was eating her head every day with questions.
that's okay. That's
But
what I
yeah,
am for.
yeah. And her classes, she is also helping you out in a way like she is explaining with rationals which all you need, because in exam you cannot just mug up things and go there. So
That's
you need
true.
to know what is the rationale why you are choosing this option. So that's what Mamta is doing. She is stimulating your brain by asking a lot of questions. There are a lot of questions I still remember. I was calling her with one or two questions, and I end up with four or five more questions, but it was helping out. And yeah, I felt the change in exam actually. I scored really good in ethics.
That's great.
Thanks
Juhi.
to Mamta, yeah.
So the Juhi's point is valid. Rational. If because in exam every questions are new. It is not that you know the questions and you are clear the exam. No. In exam, your mind, your application, and your presence of mind, both everything is important. And scenario is if you know the scenario because you have a 1 minute, that is a strategy. Now, what is the strategy? There are total 200 questions and you have a 4 hours. So imagine that. Let me show you the calculation. So calculation in terms of just you have a 200 questions and you have a 4 hours. If hours are divided into the one hours, so you have a 60 minute and 50 questions per hour. So I always prefer my student to practice yourself. One question, 1 minute. So at least you're gonna finish 60 questions in 1 hour. So at least you have a 10 minutes more. So you can use that 10 minutes for whatever questions you feel tough or whatever question you feel that, okay, I need to think. In exam, you have no time to think. Always remember. So you must know the concept, you must know the scenario and how to evaluate that question on the basis of ethics, on the basis of given concept and on the basis of elimination of the answer, wrong answers and find out the correct answer. All the technique, it is not one technique. Even any question, there is no one technique. You have to read your question 2 to 3 times, at least 2 times from start to end and only question what they are asking. That what is the best approach of therapist? What stretching exercise you are giving except. So that word, minor word are important. Except, not, best. So these are the very, very important. You all give the IELTS. You know that importance of the small things. So these are the read the question 2 times, whole question and only question. And then read the options, 4 options. Never jump on very beginning you think, okay, this is the answer. Never jump. Take your whole 1 minute to think why I am selecting this answer, correlate with the question, and why you are not selecting other 3 options. Now, this is the for new students, those who are, I can say, right now understanding the concept. So whenever you are doing practice, question answer practice, invest your time to understand the questions, invest your time to understand the answers and why you are not selecting other 3 options. So that concrete your rationale. Okay, so that is very, very important to concrete your rationale about elimination. And you can apply all the strategy, elimination strategy, selection strategy, keywords, everything you have to apply to every question. So mentally, you have to be strong, enough glucose, concentration, appropriate eating, appropriate sleep, and really relax. I love Ankita's approach last few days before exam. In that one, she is totally relaxed. Actually, I really like it, that approach.
And to be honest, Mamta, that was my goal too, right? That I need to just keep my last days easy, but that can only happen if we are working hard in the beginning. And that was my goal. I told you, like in the last month, I don't want to hassle, I don't want to read something new.
Exactly.
So I tried, to be honest.
And that is my approach too. That if you are planning, for example, you are planning to appear the exam in the May, ask yourself question, are you ready for April? If you are ready for the April, then and then you are good to go for May. I'm just giving example. Means 1 month before, you must ready for your PC. So last month is just the preparation month. And you are not one that, okay, let me, Mamta, I'm going to give the exam in April. Come on. Are you ready? Frequency of exam is increased, not the attempt. So your concentration, it is not like you are running and catching the bus. It is not like that. First of all, you have to be physically fit to catch this stuff and then appear for the exam. So you hit the target. Here, all the thing is working with the psychologically, emotionally, as well as the understanding. your education point of view. And this is your, this is your goal, this is your achievement, that you are going higher. So for that, why you are compromise? What is the point to compromise? First of all, there is nothing. You have to know there is no shortcut. Self-concentration, self-confidence, and the firm determination. These three things is very, very, very important. And now here, joining with me, okay, I am 100% guider for my students. I always know that every students are unique. Every student has their own weakness and every student has their own strength. And I know my students because I'm always working with the limited batches. And I know that where the Ankita is lacking, where the Joy is lacking, what is the weak point of everyone's, that is very, very important. We have another candidate, Pooja. Congratulations, Pooja.
Thank you, ma'am. How are you?
I'm good. So we are discussing about the success path. Do you want to share your pathway, your journey?
Sure. So I started with Mamta ma'am. I just joined with one of my friends' reference in the month of, I think, December, first week of December.
Yes.
And I
Very
went
short
through ma'am's
duration.
very, very short.
I never work with
And
short duration actually.
yes. But it was, ma'am, definitely it was a game changer for my score. I went through your all lecture twice. It was 8 lectures in total.
In the ethics, yeah?
And plus, the thing is, you helped me like anything. I remember I used to ask a question every day, and without fail, you were answering my question. You were calling me all the time to explain the things, and it definitely helped in my exam, I would say. And I would recommend everybody who is looking for like PCE mentorship or PCE journey, like I would definitely recommend Mamta ma'am's
Thank you, Pooja.
lecture. And I'm still regretting that I couldn't took your MSK and the other thing. If I would take, then I would definitely score more than 700. This time I scored 700.
700, you feel like, oh my God, Pooja, don't be greedy.
Yeah,
Oh
I would
God.
definitely score more than that if I.
No, it is the best score ever. So the thing is, basic thing is your concentration. Nothing for that. Like you cannot escape. You cannot escape. You have to do that thing. And ethics is the background. Like ethics, you cannot escape the ethics. Ethical thinking. Okay, now come to the point that whenever you are studying the MSK, for example, MSK, but what about the assessment? Assessment, correlation of that MSK topic. So whenever you are preparing yourself for the exam, first of all, finish your concept about every system, other system, MSK, cardio, pulmonary. Afterwards, you have to correlate MSK with the cardio, MSK with the pulmonary, MSK with the other systems. Scoliosis, example. Okay. So scoliosis, you may end up, your vignette start with the scoliosis, enter into the pulmonary restrictive lung disease, out with the lower limb, LLD, limb length discrepancy, with the orthosis and with the ethics. So if you are prepared yourself, then in exam you are easy. Why? So see, if you are coming first time in Canada, for example, or anywhere, 100% you don't know what is going on, what happened. I have no idea how to navigate. But if you already plan properly that okay, before going to Canada, if you are planned that okay, this is the region where I am end up, my friends are coming to pick me up, I have a arrangement for the house, then it is your journey is easy. And on the top, if you get the job, 100% easy. Same thing apply here that if you know the concept, how to understand that concept with the correlation. PCE is always correlation. That's why in my lecture also, before beginning the lecture, I think Rujuta, you can say something for the lectures. Beginning
Oh
of
my
the
God. I do lectures. Oh my God. So, first of all, I just want to say that I have not yet cleared my exam, but I can say that when I joined Mamta, it was in a way just as someone said, it is a game changer. It is actually a game changer. The perspective is completely changed. The way you look at the book it's changed. First, I used to read Kistner, just the first cover page and then keep it aside. But then I realized that no, there is much more, and that was only shown by Mamta. And everything has in the lecture itself, Mamta clears everything. And any doubt, silliest point, if we ask, she will answer right away. And most important thing about the lecture is that they are very interactive. Like often we have seen that when you attend lectures, the person who's speaking, they will just keep on speaking. They will not care about whether the student is registering it or not. But Mamta, she will, when she speaks about a topic, she will ask a question. Okay, this person, that person, and I
Rujita
told
is
that right now.
understand. I know Rujita is
I told
understand.
every time I attend the lecture, at least twice, thrice I am being asked, and I have to be spot on. I have to be so ready. I also mentioned Mamta that Mamta, why do you always ask me?
She's
That she's like,
personally
who
asking
should
me.
I ask?
Ashwin, Deval, everyone is used to with me nowadays.
Yes,
But that
but
is
yes,
important thing because how
very
I come
important.
to know that you are attentive and you
Exactly.
understand the topic. Yes, Ankita.
Yeah, here relatively, I will say that that is something, which we need, because if here people are like internationally trained physios, right, or PTAs or whosoever, I mean, we have been studying in a certain pattern, right? And the thing is, the exam does not demand that. The exam is entirely different. It is again the bachelor level examination. Okay, you will have your all the basic books. You will have the same questions, everything, but only the strategy is different in a way that everything is correlated. And here, usually people lack, or we usually lack there, because how to navigate that, how to jump from MSK to ethics to pulmonary and all that. So I mean, you really helped us to just open that pathway, and even for us to individually think in that way, to be honest. So that was really, even I would agree with Rujita that during the classes, I took mentorship with you. So I mean, those interactive sessions really help to inculcate that confidence, I mean, in me, right? Otherwise, you usually shirk, even though you know that, okay, which kind of orthotics or this or that, but you will shirk, and you might not want to answer. But I mean, yeah, if Mamta is there, so everyone will be there. You have to answer, even if you don't know, that's fine. And I mean, she motivates you a lot, so at the end of your journey you will literally be more confident. And and plus the questionnaires which she will give you, right? So eventually I felt that that kind of inclined my critical thinking more.
All
Definitely we are
studying
doing
is critical
rational.
thinking.
Exactly. So just if you're reading the books and you're not solving questions, I mean, that's also not a good thing,
Yeah.
because questions will kind of like align all your knowledge in a way, and also give you a pathway in which way to think whenever there's a question in front of you. Yeah.
That's correct. You know, the thing is, your theoretical classes, right now, what Rujuta and all this, my students are regular students are going on, that is a regular classes. But mentoring, where your active participation is important. Even I am not allowing my students if you are not ready, because it is not a passive journey. Passive learning means I am saying again and again, you are not, that concept, you are not, that doesn't go in your mind. You have to ready with your reading. Then and them, I'm allowing them to enter in the mentorship. Samiksha, I know you are end up with a lot of questionnaires sometimes with the mentoring right now. So basically, that the thing is important. Mentoring means active learning, to and fro. So where you are lacking, I can focus. Otherwise, everything I am saying that is my way. So I am the good one, whatever concept I'm gonna teaching, my strength, my weakness, I know. But how I come to know about your weakness? So when you are ready with the preparation point of view, you can do it. Okay. So mentoring is active learning, to and fro. Theoretical classes, I have a two classes, theoretical classes and the mentoring classes plus ethics. And I believe nothing is separate. If you want to pass the exam, you need everything. Concept of the theory, appropriate mentoring, it is not 2 months. It is appropriate, like I feel like 3 to 4 months is needed. And then ethical practice, question answers, appropriate mock. If again that is giving us so many mocks, you are not getting the to the point. If you are going with the 2 or 3 mocks, that's okay, but appropriate. That develop your critical thinking. Ethical questions. So I develop like pure intervention question where the students are lacking intervention. Because what we are for rehabilitation, physiotherapist, and we are dealing with the intervention to make the patient functionally independent, to return to the society, return to the community. And in that approach, intervention is must. And what I feel from the student, they know the pathology, they know the diagnosis, they know the small thing of the MRI and X-ray. But again, when it comes with the intervention, that's not correct. Intervention, read it appropriately. So if you are dealing with your question with the maximum protection phase, acute phase, your goal, to achieve that goal, what is your intervention? Everything is important. And criteria to progress. It's not like that I'm going to treat the patient. No, you have a timeline. That okay, I'm treating the supraspinatus tendinitis. Patient may be within a 2 week going with the subacute phase, within a 2 week going with this. So this is the tentative timeline. Every time reassessment and develop the goal. Discharge plan. Discharge plan is very first initial assessment. After initial assessment, you have to go with the discharge plan. So this is the everything where therapist is centered to think for the center of the patient. So patient and therapist are close relation to achieve the functional goal. Medical treatment, if you don't know about the component of the TKR, if you don't know about the processes and all, that's okay. But maximum protection phase, goals, interventions, safety. If patient has a no hip abductor strength, you are not going, or hip, quadriceps strength, you are not removing the assistive device. So this is the safety. Weight bearing instruction that is not delivered by the therapist. Therapist must know before the gait training what is the weight bearing status, which is described by the orthopedic surgeon or the physician. So we are not going over out of scope of practice. We have to work within our scope of practice ethically and then answer the question, whatever it is asked in the MSK or the neuro, whatever. Okay. Second thing, so theoretical concept, I'm trying to cover that theoretical concept very easily, very clearly with the book wise. Mentoring, even though my mentoring start with the cardio, but I think it is end up with the ethics, or I think it is end up with the, I can say, what I can say, another like cardio start and I'm going with the orthosis. I think Mega is the one who gives the proper answer in the mentoring. Right now, she is in mentoring. What do you feel in Mega, like regarding the lecture?
Ma'am, I have no words. But seriously, like your mentoring is the best. I got it.
No, that's okay. Like best, everyone is best. But the thing is how to approach with the student and being a mentor. What is my duty for you guys? That is important.
That's correct. That's important. And like for me, like I was lacking in so much areas, but you covered everything because today I got question regarding pulmonary and next day I got question regarding other system, but you were there. So that's the best thing for me.
That is important. To
Yeah.
clear the exam, we
even
know
I
them.
started doing all the lectures before. I did study buddy lectures like thrice, but
I
still
don't
my
want to say
concept.
anything for anyone.
Yeah, but I did, but now you gave me access 1 week back, right? So when I'm in at my job, I just took my AirPods and I'm listening to the lectures, and now I am doing all over again, like from scratch. Other system, I did all your lectures, and now I did few questions which were in my last 2 attempts. I have those questions with me, and now I'm able to do it. So for me, I think I'm going back again with the lectures. I'm not going to the Kistner with the thought that oh, I have did lectures thrice or 4 times. Now I'm starting from scratch, and I'm doing like this is my first time, and I have to do all over again, and it's helping
first
me
and
a lot.
last time.
Yeah, first and the last time. Yes.
Yes, Rujuta.
So I have a lot of things to tell about your mentoring. So can I please share
Yes,
few thoughts about it?
definitely.
So when I started, just as Ankita said, the first time you gave a call, I was also in a dilemma whether I should approach you, or I mean, whether should I go ahead with you, because we are at a stage where we have already faced failures, and we are at a stage where we are confused completely. But then the way you talk at the very first call, it absolutely makes us so relaxed and it feels so motivated. And I remember, Mamta, the way you told me, you start with this, read this, read this. The best part about your mentoring is the follow up. The way you have given me your energy, that transition, Mamta, I don't know whether I will be able to clear my last exam or not, but you know what? I really am so happy that I met you and you are my guardian angel. I mean, I can say anything about Mamta, every good things about Mamta, because since last 2 years or 1 year, I don't know, I don't recollect. It's been 2 years I know her, I think. But in these 2 years, every damn thing I have confidence in because of Mamta. I can say that mentorship, I started with mentorship, but every book I read, she guided me right from day one. Read this chapter. Now read this. This is how reading. And I remember regarding pregnancy, one day Mamta called me in the morning while going to work. She said, "What are you going to study today?" I said, "Pregnancy." Then she said, "Okay, study these parts. This is important. This is important. Okay." And throughout the day, I studied. In the evening, while coming back from work, again, she called me up. "So, what did you study finally today?" I said, "Pregnancy." "Okay, answer this question." I said, "This." "Okay, answer this question." I said, "This." So that time I answered almost, probably out of 10, I answered 5 or 6 answers correctly. She said, "Okay." After 1 or 2 days, all of a sudden, she asked me something related to pregnancy. I said, "I don't know. I don't remember." She said, "This is what you have to do. This is how you have to study." That when you
Recalling is
study,
important.
any time, even at the middle of the night, you are in deep sleep and you get up, I ask you a question, you should know it. That is how her mentoring is, and that is how she keeps us on toes, that no, if I am in that zone of getting that, clearing that exam, you have to be in that zone and you have to be in there. This is the best part about Mamta's mentoring. And for
Thank you.
other classes, I don't know where they are. It's
That's
more about
okay. That
us
I don't
following
know.
them. But Mamta, as a mentor, we really want that the mentor be with us. That's the point of having someone to guide us. And you have always guided me, at least in the right path. And I think everyone here will agree that, as
Yes.
everybody is saying, that any question, you answer it. I still remember that anything I don't understand, I take a photo and I send it to Mamta that I don't understand this. After 10 minutes, she gives me a call. This is what is the real explanation. This is how it goes. This is the actual meaning of this. And then she said that, "Rujuta, you are also helping me. You are also helping me that how I need to strengthen my teaching." So this is that two-way communication. Mamta, this is endless. I mean, for you,
Yeah,
it is
that's the
endless.
key.
I
So
can go
how
on
to
and on, but
study?
I'm going to I'm going to mute
No,
myself. But that's why I can't stop telling anything
no.
about
That is not the thing. The thing is to and fro study. Basically, what is the role of as a guiding person? What is my role? That comes in picture. So, what is the guiding role? So, I must know my student first of all. Second thing, I must know what they are lacking. Every student is unique. Every student, somewhere they are good, somewhere they are. I can compare if Ankita versus Pooja versus like I have a like students and number of the students, for example. But if I'm gonna say two only, some are good with some concept, Pooja is good with another concept. So I cannot compare that, okay, you don't know this thing. No, this is not right. I cannot evaluate with the one question with the both of you. I have to go with weakness of the Ankita and I have to go with this. Because being a mentor, being a guiding person, that is my duty. To understand the concept. Right, Pooja?
Yes, true. Actually, I want to add one thing. Though I took just the ethics thing of yours, but I remember sometime I asked you question of pulmonary cardio, anything, but you were still there. You didn't told me that, "Oh, no, I can't answer this because of you didn't took my the other thing." So I think that
Because
is
my
the
goal is to give you the pass result. It's not
Yeah.
only ethics. That's why I'm
Yeah.
asking.
Yeah. So I'm
Same
really
with me. I
grateful.
was also asking preliminary questions to Mamta, and I was also feeling bad. Like I took just ethics and asking about other system, but she
Doesn't
was
matter.
like, "It's okay. Whatever question you come to me, this is your exam, and you will have to crack it. There is no if and but."
So
Yeah.
that is a confidence, Julie. The confidence, it comes when your concept and your trust in yourself,
Yes.
that comes in picture,
Exactly.
then you are good to go for exam. Like
And the personal
exam,
attention she is giving, it's a lot. Like I took someone else's mentorship, and that person never called me.
that's okay. I don't
So,
want to
but
discuss
I'm
anyone's
linking.
mentorship and
Yeah.
everything. But the thing is, simple story that you are a soldier going for the like the fighting thing, and then you are afraid of the sword. Same thing. You must like exam. I don't care about the exam. Exam is tough. Exam is easy. Always it is easy when you are prepared, and always it is tough when you are not prepared. As simple as this. So if you are understood the concept, you understood the correlation, you understand the ethics, good to go. But if you are not understanding the things, you are stuck in between. So that portion I always say, like those students who are appearing for the exam, go with correlation. First, clear your concept, go with the correlation, go with your focus. Even though if you don't know anything about asking question, don't be panic. If you are panic, gone. All the game is gone. So now here I want to focus few things, and that things is time management. You have only 4 hours. Time management means you must know what is the importance of your given question in only 1 minute. If you don't know the answers, may spend 30 minutes extra. Even though you don't know the answer, forget it about question, move on. If you don't know one question, you are not going to fail the exam. But if you are thinking for that question and you are giving the answer of other questions, you cannot concentrate on your given question. Concentration is important, keywords are important. Otherwise, it is just a written story. Questions you need to understand, and for that your focus, your concentration is like you are seeing the bird eye in the according to the Hindu religion, Arjun's story. So that thing is important. That is very important. You should not be panic. Even though you don't know the concept, you don't know the answer. One question, two question, three question, it's okay. Move on. So that way it is easy to navigate. And don't move on without giving the answer. At least select one. Whatever is the best. Okay, now identify that you are a therapist in that given situation. What you're gonna do best in the given scenario, and select the answer and move on. Don't be panic. If you are rushed with your last few questions, I heard a stories from the students that okay, I get the rush with the last 20 questions. Gone. If you are rushing with your last 20 questions, means you are not reading your questions. You are not reading the keywords. You are not reading the options. And then, even though it is a scoring questions, you cannot get your answer. Getting your answer is important. Yes, Juhi.
Mamta, in this exam, I follow one strategy. I first attempted last standalone questions, and it helped me a lot. Like at last time, I also did the same thing, but somehow I lagged somewhere and I failed. But this time, those things were helping me out, and
Because
I
it is
also
the
got
ethics.
30 minutes extra
Because
because
you
I
you are
already
on the ethics
completed this
based
thing.
last question. Like
Yes,
whatever,
and
your
it was
concept
also
is clear.
scoring area, I guess. Last 20 to 25 questions, I attempted first, then I started from first.
Because your mind is fresh. Early, so brain uses glucose. So early you are fresh mind, focus with your scoring portion. That's okay. It's everyone has a different strategy. I'm not saying that you have to go with the last questions. Depend. You can do it, but do not rush. Like do not start to rush with the last question means 20 to 25 questions are the standalone questions. If you are wrong, wrong. So you have to be focused with that questions and the answers, and it is really scoring. And then go with the vignettes. Vignette, if they are giving these some clues, try to figure it out and then keep it in your mind to answer the questions. If the beginner does not say anything, focus with the questions, focus with the answers, and select on the ethical background. So that is the overall story for that. Anything? So once again, congratulations to past student. It is really important to cheer up yourself, having a relaxed weekend.
I would also add one thing that this exam do challenge your mental health a lot, right? In terms of
Yes.
anxiety, in terms of how you feel that, oh, I don't know anything, or maybe I'm not capable of becoming a good clinician or something like that. So I mean, yes, the focus first is to just clear the written exam first. But the thing is that there is no shortcut, guys.
No
So
shortcut.
the thing, yeah, there's no shortcut. That's what I have learned, and I would say that always we should always remember that this is just not to clear an exam, which is written or clinical. We have to become the clinicians too, right? And I mean, we should be just, and you're going to practice in Canada with a lot of ethical background, so it's going to be challenging. But in all that journey, it was tough for me, but I did always talk to Mamta about it. I'm very vocal about it. So she always told me one thing that, Ankita, okay, I know that you are feeling low right now, but do you know that because just of your anxiety or because you are feeling low, and you know those things, but you're just not confident, you just lost 1 hour of your day. You just lost half an hour. You lost 2 hours. Then you will lose 3 hours because you are still sitting idle just worrying about something which is not right happening right now, or you don't even know that is supposed to come or not, right? So I would say that remembering this thing that if you are anxious, if you are not feeling great about it, I would say rather revise something, some topic which you feel happy about, which you feel confident about, but don't break the streak, because when you break the streak, you lose time, you lose confidence, and eventually your whole planning, I would say. So this is something which Mamta taught me really, because I would contribute my mental health to be a big problem of not clearing my last exam. It was not majorly my knowledge or something. So the way she helped me to navigate not only academically but even my mental health, I would say, that was amazing. And I know most of us go through that or will go through that. So I will always tell you that
Even I
remember.
am a student, I am going through that. It's not only you. Even I am a student, whenever I am giving my exams, I go through that thing, that feeling low, but that wasting of your time.
Yeah.
For example, you are doing the job. I never say my student to skip the job. Never.
Yep.
Because the thing is, if you are capable to find out your 8 hours, 6 hours in a day, even though you are working, more than enough. Compromise your sleep rather than compromise not doing anything. If you're not doing anything, take it positive way. Everything you have to take positive way. If you are not doing anything, oh, at least I have a 12 hours. I can focus more. If you are working, oh, I can challenge myself. I can go do 6 to 8 hours. Challenge yourself in a positive manner. Depression, negativity, anxiety, I can't do it. That type of the words, put it in a box after result or after giving exam, open that box. That's it. We have in our dictionary, we have not that type of the negative words. That's a success thing, that we cannot focus on that. Whatever I can't do it, if I'm going to think for that, I cannot concentrate what I can do it. So you have to concentrate on your doing portion. And if you are doing step by step, you can go with the climbing thing. It is a stair climbing. It is not an elevator that you have jumped with your first floor. You have to go with this baby step, and achieving the baby step is a good thing. It is one of the reward, like giving you a reward that, okay, I did this thing, good thing, go ahead. So that way, confidence, concentration is slowly developed. It is not like one day process. It is a long journey. So in that long journey, keep your motivating level, keep your focus, keep your some student in that journey. I come across with so many students. They are very good when they are started the classes. Like, oh my god, I doing this, I doing this, I am doing this, and then end they are down. And they are down means they don't know what to do, how to do, where to do. So what is the point for doing the hard work in your early study? Everything is vanished. So maintain that flow. Maintenance, starting is easy, maintenance is hard. And if you are not maintaining things, you are not achieving your goal. So whatever Josh or whatever focus you are starting with your starting journey, that journey you have to keep it until your day of exam. Then and then you achieve the goal. Yes, Pooja.
Yes, I would also agree with this, and I would like to say one thing. I remember, like, 2 weeks before exam, I was like, no, I cannot do it. But you were there. You told me, no, I know you can do it, and you know everything now. And I still remember there was still some topic I was saying that, Mamta, I think I haven't studied this, and you were there to told me that don't worry about it. You know 90% now. You don't worry about the other 10% thing. Just focus on 90% whatever you have learned. And I believe me, I follow that.
That's
And it
important.
really helped me. Yeah.
Last moment, you are not going to learn new thing. Last moment, don't do anything new. That's it. You have to do revision because in your brain, neurons are developed, already developed. If you do the revision, it become concrete. But what happened? You do the new study, the already learned neurons are vanished. New neurons are not capable to focus. So whatever your last moment, if you are doing the new, you are going here and there, 1 month before you are done with your study, just revision. And even no mock test. No mock test,
Yeah.
nothing. Yes, you have to do the question answer to keep you like continue with your focus and navigation of the things. But it's not like, okay, I am going with the mock test and in the mock test I am getting this score. Demotivating. Come on. This is the planning exam, planned. And they give planning. They are not giving that, okay, you have to write your exam on this date. They give you selection. So once you select your date, you select your whole time management. You are not going to decide that I am going the exam in April. And right now it is February. So 2 months, are you able to do everything? Are you able to ready for March? So this is the scenario. It is not the rush. It is planned thing. Time management, planning, your emotional thing, your focus, everything is important. Yes, Chewy.
And you know, if you feel you don't know some concept in the exam time, just work on your elimination strategy.
Huh.
Because sometimes you feel in the exam, during the exam, okay, I haven't read this concept. Don't panic. Just focus and work on your elimination strategy. Two option you can eliminate very easily. And other two option, use your brain. So you can
Ethics.
get the answer, still you can get the correct answer.
Yes, that is important. So that is, and I believe you are the one. You are discussing with the others. Yes, discuss. But don't rely on others. When you are dependent on others, you are gone. Be independent. We are also working to make the patient independent. Why we are lacking behind? We have to be independent in our study. So
I would like to
yeah, go
say
ahead.
one thing, Mamta. I think I follow one strategy. I think people like what thing helped me the most is when I wake up early morning, I first revise the basic thing like special test everything. I have decided, I have allotted all the days, I have planned all the days, these days I will do this that. So I just follow that. And before you go to sleep, you should ready everything on your desk that next day what I'm gonna do. Because sometimes what happen when we like suddenly just show up on our table, and we plan like we take 2 to 3 hours to figure out what we will study, and it will waste our 2 to 3 hours, and then we get
Planning.
tired.
Yes, that is
So
very important. Planning is important because if you are thinking on that day what I'm gonna do study, you are wasting your 2 hours.
2 hours, yeah. So and
Definitely.
revise, yeah, revision like 1 hour basic revision, and then choose your weak point. And every day I would suggest 2 hours of ethics.
Do
Yeah,
not lie with yourself.
yeah, I know, yeah, true,
Do not lie.
yeah.
Okay, I know, yes, yes, I know this thing. If you don't know, yes, no, mom, I don't know. And I need to work on that. So, like, the thing is, if I say something, for example, Pooja, I'm saying to you that focus on the equipment portion, like the modality portion, and you know that I didn't finish. You know. Okay.
Yeah.
But you are saying, yeah, Mamta, I did it.
Yeah.
In front of me, you are okay. And I may believe in you, but it shows in your exam result.
Yeah, right.
Okay. So don't go with the, like, first, don't lie and make a plan and stick with that plan. Everything is important. And every day motivate yourself. You are the best motivator for yourself. I am always motivating my students, but why? There is no negativity, nothing. Even impossible word also saying I am possible. Every time, if you are thinking in a right way, you will get the success. And the second thing is, there is no luck. It is all
True.
based on hard work. If you
Yeah.
are doing hard work, luck will follow you. But if you are depend on the luck, then doesn't matter. So I believe that everyone is passed. Yes, they did hard work. And everyone is failed, like whoever doesn't clear the exam, some is lacking. I'm not saying that they are not hardworking person. They are hardworking person, but the results are not wrong. So believe in that result. Start with the scratch. If you are thinking, okay, my last attempt I scored 590, 595, you are 600 point behind. So first accept and then move on. Yes, Joey.
One more thing, don't overthink.
Overthink.
While in exam, you're gonna feel, okay, I choose this answer, you flag that answer, and again you will go back to there and you will change. At the end time, you don't have much time, and your brain is also not synchronized to the wing at that time. You are in hurry, so don't change the answer until you're 100% sure.
Very important point. Because whenever, for example, I'm on the question number 56. I doubt, but I gave 1.5 minutes to this question with vignette, everything I understand, everything I did, and I eliminate the thing and I finalize my answer. Still, I flag that question 56. I done 200 question and now I have a 5 minute remaining. In that 5 minutes, I jump to my 5 flag question. You cannot concentrate on your vignette. You cannot concentrate the way you are thinking with the very first time. And this is again normal human psychology. That if you are going to select clothes in the store, first you select one thing and you are buying the another thing. Normal. Same way. If you select your one answer with your first thinking, when you jump on that answer, you change the answer. And the moment you change, it might be wrong because you have no time to think with the key points. And you already give enough time to that question. So try, do not flag the question. Try, do not flag, right away think within a 1 minute or 1.5 minute max. Hardly flag 2 or 3 questions because anyhow students are doing the rush for the last 20 questions. So don't do this mistake again. Yes, Joey.
While you're answering ethical questions, focus on the scenario. If it is hospital-based, private practice, or nursing home, and also focus on the work least expected, most important. Those kind of keywords. Those keywords will change your answer. So always focus on that. And even you can also highlight those things. They have the option in their software.
So that is important. So overall, this is the most important thing. Once again, congratulations to all the students and best of luck to all the appearing students. And you have a good opportunity to focus with the strategies. We are always dealing with the strategy in the given lecture, like in the lectures also, theoretical mentoring. But yes, focus, confidence, no shortcut, believe in yourself, do not lie, be a planner, and be yourself game changer. I am the supporting person, guiding person. Okay, thank you very much.
Thank you, Mamta.
Thank you
so
so
much.
Thank you. I'm gonna done this. Okay, have a nice weekend.
Thank
Bye,
you.
you too.
Take care.
Bye.